information technology is taking the whole world at another level, from one other level to another one. And I'm saying this with all sense of purpose, because everything now is AI, termed. So the phone I'm using, the TV you're watching me from, the audio that you can hear from the other side, almost everything is powered by technology. Now the health sector is not an exception in this drive. So how do we deploy information technology to help in the health sector? This is what we want to take a look at this point in time today on the show, as we move ourselves from one point to another, moving with the trend so that we can get the best value for everything that we can have. This morning joining us in the studios is a health informatics professional. And I heard that for I said, okay, informatics, okay? Let me learn something this morning. Ayo Adebamo. Ayo, thank you for joining us on the show.
Thank you very much.
I saw informatics. I said, okay, information and ticks there. I went to just join things together to see where we're headed and all of that. Tell us more first and foremost about the way and manner the technology, especially information technology, is impacting the health sector.
All right, thank you very much. It's a pleasure to be on this show this morning. Absolutely, information technology has a very big role to play in managing healthcare. The easiest way I want to describe it is this: if we look at Nigeria, say 15 years ago, compared to now, we will see that over those 15 years period, there has been massive deployment of information technology in different sectors of the Nigerian economy. For instance, 15 years ago, there was something like Uber. There was not, if you look at the deployment of information technology in the education sector, 15 years ago, it was not possible to say you want to check your WAEC results online, or you want to sit for UME exam online and all of that. But today now, we're seeing how information technology has penetrated our banking sector, our transportation sector, our education sector, entertainment industry, and all of that. However, one area of big challenge in Nigeria is that information technology has not penetrated the health sector as it should, and this has massive consequences. This has a big impact, in terms of the quality of healthcare that Nigerians are able to access. So in a very simple nutshell, there's a lot that information technology can do, to be able to promote, to promote and facilitate delivery of quality healthcare. So, but I think let me put it this way: the first question that we need to look at is, why do we need to even think of deploying health information in the healthcare sector? So it's a very critical question that we need to address. Before, unless we have the why, that we might not have a strong motive to want to go in that direction. So I like to say that, look, the healthcare sector in Nigeria is among the worst in terms of health indicators. For instance, if you look at life expectancy in Nigeria, it's just about 53 years compared to 83 years in Japan. So it means that by virtue of just living in Nigeria, the average person is expected to, die 30 years before somebody living in Japan. But let's even move away from life expectancy. Let's look at the patient to doctor ratio, the doctor to patient ratio. Now, the WHO, World Health Organization, recommends that the ratio should be 1 for 1 doctor to 600 patients. In Nigeria is 1 to 8,000. So it means that we do not even have enough healthcare, professionals, doctors, nurses, physiotherapists, etc., to serve the critical mass of 200 million populace. So what do we do in that case? A lot of our doctors, they are in, what we call JAPA. They are immigrating. It's all in the news constantly. They are overworked, they are overstressed. So, and we know about this problem. The question that we are not seeing, the conversation we are not having in our country is that we are not talking about the solutions. So one of the solutions that we want to introduce is the health sector.
We'll come to that so that we'll take it one after the other, Mr. Ademamowo. Now, for those watching, say, information technology, what about health? What information technology needs to be deployed in the health sector, especially in Nigeria, so to speak? So what are those, in what forms do these come? So that people can really relate to it before we take the discussion of this.
All right, thank you. So again, I want to use analogy that people are already familiar with. Facebook, a lot of people know what Facebook is about. A lot of people know what Uber is about. A lot of people know WhatsApp and all of that. These are platforms that allows you to share information with another party. So in a very simple nutshell, when we say information technology, we are talking about technology that enables and facilitates the sharing of information across multiple parties. So how does this apply to the health sector?
Yeah.
You know, so again, using some very practical illustration, it means, for instance, on my laptop or on my mobile phone, I can be able to, you know, engage with a doctor from my mobile phone.
Okay.
You know, I can be able to engage my mobile phone. I can now engage with a doctor on my mobile phone. For instance, there's something we call telemedicine. You know,
yeah.
which is ability to have a virtual consultation, you know, with a doctor without needing to physically, you know, be in the hospital to attend to, you know, to see a doctor. That is one example. Another example is this. On my mobile phone, for instance, you know, I want to be able to have access to my health record. Do you understand? You know, so I want to have access to my record. So, for instance, maybe
like data management.
Like data management.
Okay.
You know, each time I go to the hospital, you know, maybe the doctor asks me, you know, they gives me a prescription. You know, I want to have a record of my prescription. Or each time I go to a doctor, they ask me to go and do a test, a CT scan, an X-ray, and all of that. I can have all this information. Each time the doctor sends me a referral, maybe you need to see a specialist, I can have this information, and then I can be able to share this information with another doctor, for instance. Maybe I want a second medical opinion. You know, we know that in Nigeria now, one of the challenges of the health sector is the case of misdiagnosis. You understand?
Absolutely,
wrong diagnosis and all
yes.
of that. You know, so if I have, you know, through health technology, you know, through information technology, imagine I have access, you know, to be able to have control of my own health information and then be able to share it with a, you know, with a healthcare practitioner, you know, for second opinion and all of that. So even for the hospital, for instance, now, you know, it's just it's unfortunate that a lot of our hospitals, there are about 42,000 hospitals and clinics in Nigeria across all the 774 local governments of Nigeria. You know, the vast majority of these hospitals, they are still using paper records. You understand? You know, so whereas, you know, there are very cost-effective and simple and reliable you know, electronic medical record platforms that hospitals can come upon, you know, to digitize their record, and so that when you know, so when you go to see a doctor, for instance, you know, you don't need to be looking for your files, or your file is hidden, or somebody is asking you to bring some money before they can bring the file for you, or the case of maybe something is missing from your note, there's case of wrong information, you know. So all the world has gone beyond that, and this technology is already available in Nigeria. You know.
Let me come to that. You still continue in that line of conversation. I know maybe a fortnight ago, I was at the hospital, and my cousin needed to have a consultation with the doctor, and he just mentioned his name. So I remember, of course, the nurse went in, or maybe the attendant went in to check, and of course his name popped up.
Absolutely.
However, they will still have to depend on a file. Is this information technology intending to totally knock off and out of the system paper record documentation, or this will still continue to go hand in hand?
It depends on how the health facility wants it. You know, so there are facilities that are completely paperless. You know, they do not need, you know, they do not to maintain any paper records. You know, so of course we also realize that there are some facilities that are still in a bit of a transitional phase, you know, so it's like they're operating in a hybrid model, meaning that some of their, you know, health encounters are being managed electronically, and while some are still being managed, you know, through paper records and all of that. But my point is this: it is possible for a health facility to be completely paperless, you understand, you know, because there are already facilities that are doing that, you know. But for those that maybe they do not have all the means to be able to do that, then there's still a way they can be able to, you know, manage the two. And even on the part of the individual as well, because it works both ways. So on the part of the hospitals, we have what we call the electronic medical record. On the part of the patients, also we have what we call the personal health record. You know, so in other words, some of those my record that are with the hospital, there's a way I can have access to it, and I can store it, you know, on my platform. And even in our country, Nigeria today, there are a number of providers that are already indigenous providers, you know, that are already functioning in that space, like my medical bank and all of that, you know, that already have, you know, they provide this means by which these, you know, individuals can be able to manage, you know, their health record, you know, go paperless, as you know, whichever way you want to call it. Absolutely.
All right. Okay. If you have any question for Mr. Adebamo, please don't hesitate to call us on the show. Maybe one or two calls, then we just wrap up at this point in time. So, what you're calling for is something that will help us to be compliant.
Absolutely.
I want to imagine that most Nigerians are still not talking about thinking about the impact that AI would have on us, perhaps in the next 5 or 10 years to come.
Absolutely.
They still are thinking the way that I'm going to keep my thing here, I'll meet it here, and that's the way it's going to continue.
Absolutely.
So from your research, what have you discovered with how much the health facilities in the country, those owned by the government across board and private institutions, are really taking advantage of information technology in healthcare?
So again, this is one area of big challenge in our country that we're not seeing enough conversation in terms of public institutions, in particular public facilities, trying to adopt AI, artificial intelligence, and all this new technology. And the interesting, they are not even that expensive. That's just the interesting thing. For instance, there's a big opportunity which I believe the government, even the private sector, can come in. For instance, let me make it very simple. So we have a number of solutions in the market now that let's say I enter my data. Let's just say I'm checking my blood pressure or my pulse or my vitals. Basically, I entered into my phone in my app. So by doing that, the algorithm, the artificial intelligence algorithm built into that app can be able to tell you immediately that, oh, this blood pressure is too high, that it predisposes you are at the risk of being hypertensive. You understand? And then these are some steps that you can take to be able to do that, to do that, then, for instance, let's say, oh, okay, I enter my data into one of these apps, for instance, then it can tell me, oh, look, because you are a female, you are between the age of 25 and 50, you are supposed to have had a cervical cancer screening. It is recommended, let's say I'm a man, you are supposed to have a prostate cancer screening, because these are preventive measures. So there's a lot of things. So it's like generating personalized health information for you that, okay, based on your personal circumstances, based on your family history, based on your genetics factors and all of that, these are the conditions that you are at risk of. For instance, for me personally now, I know that because my late dad was diabetic, and he also had a history of eye problem, glaucoma. You understand? So automatically, I know that I am at risk, because of that. So there are some steps I'm consciously taking that I don't develop those conditions. So that is where knowledge is coming from. And one thing I want to add is this. Healthcare is very expensive. So my advocacy is that, look, let's focus more on preventive healthcare. Let's focus more on preventive healthcare. And one of the ways we can do that is by leveraging on this information technology, artificial intelligence, and all of that to give me the kind of information I need to be able to prevent the onset of these conditions. Okay, so if we want to break it, we have to go in the next 3 minutes. But then, for a lot of people, they will say what technology has brought upon us, the gains far outweigh whatever kind of anything that you want to do, whichever way you want to criticize the technology. But in this case, we hear that all of these devices are very expensive. How expensive is it to really ensure that we also fall in line with information technology in pushing through with our healthcare sector? Okay, it's a misconception. I mean, just think of, let's look at WhatsApp as an example. I know it's let's just use WhatsApp as an example. I believe that most people know the value that WhatsApp brings, but what will have, even Google, Facebook, and all of that, in terms of social connectivity and all of that, who would have imagined that something as valuable as that is free? Do you get my point? So this is the point I'm trying to make, that even within the health sector, a number of these solutions are actually free. That's the first thing that I want to say. Some of them are free, in fact, a lot of them are free, and even for the ones that are free, they are not that expensive. That the most important thing that a lot of facilities and individuals require is most likely access to the internet, data to be able to, connect online, or a mobile phone,
also devices,
a mobile phone, or a computer in the case of a health facility. And again, we know the numbers of ownership of smartphones in Nigeria is very high. Internet penetration in Nigeria is very high. More than half of the population.
We still need to deepen that
exactly.
broadband.
Absolutely. No, it's very high. So my point is that yes, we're not at the peak level, but at the level we are, we have the numbers already to begin to have that conversation. That look, we need to have more conversation about how we can use this technology. For instance, I know that, there's an app called My Medical Bank app, for instance, that is free, that allows people to be able to, upload their own health record, manage their own health record, get health intelligence, book appointments with facilities and all that. And there are some others, even Google, they have, some products, that are free. You get my point. So my point is this, that it's not as expensive as we think.
And then, Mr. Ademo, I hear that nothing is entirely free. No, it's to say you download this free, but if you don't have connectivity, if there's no connection on the phone, no internet, you are not downloading anything. And also, I've learned from you IT people that when they say download this app, it's free. There's something, some cost.
There's something behind. I know. And I will tell you straight away. I will tell you straight away. You are right to say that nothing is absolutely free in that sense. You are right. I won't contest that. However, at the end of the day, the point is this: there is something. What is offered for free? There's something that the providers want to gain in return. For instance, again, let me use Facebook as an example. Again, I know it's not about ads and all of that. Facebook is free, to everybody. But at the end of the day, we record our data, your name, your date of birth, your social activities and all of that. So it is those social activities that Facebook will now sell, as it were, to providers and all of that kind of stuff. You understand?
We have a phone, we have a call now. Let's speak with that person before we round off on the show. Okay, hello, good morning to you.
Hello, good morning. This is DJ from Ogun State.
Oh, nice to have you on the show. Please go ahead with your contribution.
Okay, right. Good morning, Mr. Ayo.
Good morning. Good morning.
It's so nice having to have this kind of conversation with people like you in this industry. And also, I have a question to ask you.
Okay.
You mentioned the fact that you're not trying to eradicate the means of paper documentations in the hospital. Okay. And also, I just want to get clarity on that. And also, you mentioned the fact about there's some organizations which run this sector already in Nigeria currently. You mentioned My Medical Bank. Can you talk about that a bit?
Okay. All right. So in terms of paper adoption, adoption of electronic medical records. So what I said is, let me clarify again that number one, it is possible for a health facility to be completely paperless in managing their patient's health record. In fact, virtually doing everything that they need to do, prescription, electronic prescription, referrals, tertiary referral, and all of that. Everything can be done electronically, and some facilities are already doing that. So that's the first basis. I'm also saying that, for some facilities, they might not be at that level yet where they can make everything electronic, so they can have a hybrid of paper, paper management and electronic management. For instance, they might say, okay, look, every outpatient appointment, they use electronic means to manage their outpatient appointment. So when you want to see a doctor, it's documented there. When you understand, they might say, okay, look, I want to use electronic method to manage my prescriptions, so when they want to write a prescription, everything is done there, but they might now decide that when it comes to admission, for instance, then they might now open a paper file, so pending when they're able to digitize that process, so that it reduces the cost burden on them. So that's just the answer in that regard. Okay,
I also know that some people are worried about viruses, malware, and everything going into the system, which could totally, make you lose information that you might not be able to get back. So cyber attack and all of that. Okay, all right.
Yeah, so you are right.
In 30 seconds. Okay.
Yeah, absolutely. So the risk of cyber attack is there and all of that. And of course, with a caveat that there's no system in the world, that is 100% perfect or that can be impenetrable in that sense, So, but what technology experts are doing is to mitigate, the impact of that in case it happens. What can we do and all of that? And all the providers, they are aware of that, to ensure that data is secured, is encrypted, that even if there's a cyber attack, that they cannot decrypt, the patient's record and all of that kind of stuff.
Okay, that encryption is another topic for. We're not doing ICT today proper. We'll bring it up again.
That's fine.
We've been speaking with a health informatics professional, Ayo Adebamowo. Well, thank you for your time.
Thank you very much.
And those information very vital this morning on the show.
Thank you very much.